Hi, my name is Dr. Muhammad Aalai, and today I just wanted to talk to you guys on the differences between PRP, platelet-rich plasma treatment, and stem cell treatment. Both of these have taken a lot of attention in the media over the past few years in terms of being a treatment for a variety of different medical problems. For our purposes, we're primarily going to talk about joint health, musculoskeletal health, and maybe a little bit of the cosmetic effect. Effectively, the primary difference between them, we should start with very, very basic concept stuff first here. The budget is important. If you wanted to discuss doing stem cells of any kind for a joint or for your spine or for other indications, usually you're looking at thousands of dollars. Generally, just as an example, if you did PRP for your knee, it could be anywhere from like $500, $600 up to maybe $1,000 or $1,200, depending on who's doing it. Okay, here we would be on the lower end. Again, we use high-end equipment and kits here, but I don't charge a lot of money for this. A lot of the patients in the communities we're in are managed care or Medicaid, and they can't afford those types of prices. So we try to keep our budget more reasonable for people. That's one thing. So the budget can matter. If you're going to do a knee PRP, could cost $500 or $600. If you're going to do stem cells, for that same knee, it could cost you $2,000 or $3,000. And there's different ways that we harvest the stem cells. So those cells could be harvested from you, from the patient itself, or it could be from another isolated source that we get delivered from somewhere. So those are cleansed cells from another source versus your cells that we take out of the back of your hip, effectively, from your pelvis. My preference is to take it from the patient's pelvis. That would usually be a patient that's under 65 years old. If you're over 65, generally a lot of your stem cells that you have, they may not be the best quality. Sometimes, depending on the patient, there's always exceptions. It may be better to get a off-the-shelf product for that specific individual if they're trying to do a stem cell-based therapy for a musculoskeletal problem. So that specifically would be better for people that are over 65. In that case, you might be better off. For me, I would either recommend off-the-shelf stem cells or just using PRP. It may be about the same for them. It's difficult to tell. For their budgeting concerns, we would try to start with the PRP to see if it helps and then go from there. That's for older patients. For younger patients, if they want it, they have the money, and it is in their budget, we would offer them that. Again, I would probably offer PRP for generally trying to keep the cost down for everyone. But if people wanted stem cells specifically and for asking for that, that's what I would say. So that's the first thing, is the budget. It is important to most people. Obviously, the cost is a big factor because it's not covered by insurance. The other question I would normally have to ask is, did any of the other standard treatments work? Because if you didn't do the standard treatments that are covered by your insurance, you didn't try all the other things, what should be a discussion regarding that, because patients should be offered things that are covered by their standard insurance plans primarily before going to cash-based procedures. I think anyone that doesn't offer that at all, I think you're doing the patient a disservice, because it's a little bit on the sketchy side if you're not offering them things that are covered. So at least offer them that. Some people don't want that. They don't like quote unquote steroid injections, etc. We have no problem with that. We'll go into whatever you guys, if it's a healthy, active individual, those people, they want to pay cash for something. Obviously, after explaining everything, we can offer them that. I think the other thing is that you go through the initial consultation. The patient's age and health, as I discussed, are important. If the patient is 65 or 66, but relatively healthy, runs all the time, runs marathons, we have people like that, that might be a good candidate for anything. They can probably have any treatment. If the patient is 30 years old, 25 years old, again, they could probably have that. If they have a lot of medical problems, God forbid, a bunch of things have happened to them through their early life, then maybe their blood or their stem cells may not be as good. These things actually matter because the quality of the product that we're utilizing now is the patient's own blood and cell. That can affect the outcomes. So we like to counsel the patients on what they can expect based on their physical or physiologic profile. Another thing that can, going in line with that, is, for instance, if a patient has a history of cancer, stem cells are not recommendable for a patient who has any history of cancer. In general, there is a risk of having further progression or spreading of cancer if you do use stem cells in patients with a history of that. So this is something that is generally frowned upon. You should not offer that to those patients. In that case, PRP would probably be the best bet for a patient that has any history of cancer. In that case, it isolates what your options are. That's one thing. Another thing would be the type of procedure we're doing. So if we're going to do an injection in a knee, you might be okay with just doing PRP and trying that, see how it works, going to stem cells next. I've had patients that have had surgery and it didn't work. they've had PRP and it didn't work, and so they just want stem cells. That's a reasonable option. If the patient has never tried PRP, it is cheaper in general. We would probably go with that. I can tell you some of the procedures that I do to the spine. For PRP, it might be like a couple $1,000s, but for stem cells, it could be like 4 or 5 times that. It depends. It depends on the patient, what they want, and what we're doing. So, how many levels, how many discs we're treating, what part of the spine. Things can get pretty extensive. There's a lot of stuff that goes into what you should do: PRP, stem cells, standard treatments, surgery, therapy. All of these things are basically important to be discussed with a provider who knows all of this, understands the costs, the clinical implications, any of the side effects, understands your medical history, and is recommending the thing that is best for you based on your budget, your medical profile, your age, and the problems that you're experiencing. This is very important to customize these treatments to you as a patient, because all of these factors can matter in terms of satisfaction with the outcome of the treatment. Whether that's I paid too much and I didn't get enough treatment, or I don't feel good enough, or whatever it is, patients need to be counseled on what to expect, how much everything's going to cost, and what their best option is, and then they can make the decision for themselves. So I think generally that would be a good overview of the differences between PRP and stem cells. You are going to pay more for most stem cell procedures. There is a lot more involved to it. It should be done by an experienced provider. I have been doing stem cell cases here in New York for I don't know how many years. It's been multiple years. I was one of the first guys in this area to do these into the actual spine. A lot of people will say they do that, and then you get there and they end up doing nutritional counseling. These are the things you should look out for when you're going and looking for regenerative medicine treatments with other providers. So just generally, guys, make sure you get a plan specific for you. Make sure all the stuff is properly explained, the risks, benefits, the outcomes that are expected, and the cost involved, so that you can be 100% clear on what you're dealing with. All right. Again, these are just some overviews of the differences between stem cells and PRP. There's a lot of technical stuff that I didn't go over here, guys. There's studies you can look at online in terms of what actually does what from each of these treatments. The truth is, it's beyond the scope of this conversation, but for your purposes, this is probably most of what you need to know. If you have any other questions, please feel free to go in the comments. I'll try to answer everything I can. Obviously, we're here. If you guys want to come by and stop by the office and have a consultation, please feel free. All right, again, Dr. Muhammad Aalai with Pay for Your Lives. Hope this was helpful, guys. Take it easy.